I don't know a nurse that has not experienced some form of violence, inappropriate behavior, harassment in their workplace.
When every incident that occurs, your leader on the unit is
Welcome to
required
my local, Local 100 in London, Ontario. At this workshop are ONA leaders, representatives, and members from the over 3,600 registered nurses and allied health professionals from London Health Sciences Centre, joined by Local 45 in London as well. Like many workplaces across Ontario, these ONA members are at risk. 64% of the victims of physical and verbal abuse at London Health Sciences Centre are registered nurses and registered practical nurses. They are almost 4 times more likely to be victims of violence than hospital security.
We had a gentleman who came in escorted with 4 paramedics and 4 police officers who had to be restrained in our back hall, who we later found out had been taken what we call a bad batch of crystal meth, who was in a state of what we call excited delirium. The gentleman was so violent and aggressive that some of the fire department that happened to be there earlier from a VSA who were walking out, their captain actually called them back in to assist us in restraining this person. Once he was actually restrained, it was 1 nurse left by themselves to deal with that person.
Local coordinator Jill Ross is trying to prevent these scenarios from happening. Jill and her team are educating members about reporting violence and hazards. Jill's drive is also rooted in a story with a tragic ending.
A nurse, a mental health nurse, had been run over by one of her patients with an electric cart, and that patient and the cart stayed perched on top of her for a while, and the patient was cackling. So this was reported by one of the health and safety reps from another facility. They said that the employer asked her why she just didn't step out of the way. She had severe PTSD and several physical injuries, and what resonated with me is that she committed suicide. And you know, I've had a family member that committed suicide in the past, a number of years ago, so you know, I don't know why, it just hit me really hard. And we've had several incidents at LHSC with our nurses being beaten up.
And I think one thing that we need to get across for members is that we just need to increase the level of reporting to allow those joint health and safety committees the data to support the initiatives that need to be brought forward in order to make our work environments a safer place.
I sit on the corporate violence committee, so any information I'm collecting here is that knowledge activism. I can take that forward to that committee and know that yes, we have some real gaps in our training. We have some real gaps in terms of doing risk assessments, and that it just provides me the proof.
One newer ONA member plans to take action.
Just kind of spreading the word, and then making sure that everyone's aware of the issue, and then really reporting.
I'm hopeful that there can be some change, because something does have to change. I know that we're losing a lot of seasoned, good staff. It's also preventing new staff from coming in because they hear some of our horror stories. They hear some of the situations. So maybe changing it and filling the paperwork out will help us to retain some of the staff that we do have and get new staff in, new blood, something, a fresh face or a new idea.
It's about educating our members so that they will speak up, they will become knowledgeable, they'll know that they can make a difference, and it's going to take all of us. And so whatever method any local wants to use, you know, I don't think there's a perfect one for everyone. I just think that you have to step up and start. And so just begin the conversation.